Hi everyone, today is Sunday, May 14th, 2017, and it's been 5 days since I have given an update on how my recovery is going from my Septoplasty, Turbinate reduction, and Maxillary Sinus surgeries. If you're not familiar with what those surgeries are, I'll link my previous videos down below, and you can watch them if you would like to see what the surgeries are and why I had them done. But today's video is just meant to give a little bit of an update on how things are going. If you have watched my past videos, you can probably tell that I'm talking a lot easier at this point. I've had a lot of issues with pain in my forefront teeth, the roof of my mouth, and my upper lip from these surgeries. The nerve that innervates that area of the mouth runs right through the septum, so although it wasn't a side effect I was aware of, I quickly became aware of it after the surgery, and it has been one of my biggest struggles. But there is still some numbness in my lip and the roof of my mouth, a little bit in my teeth, but not as bad. I'm still not eating anything solid that's hard, but I am eating solids. It's just more on the softer side. Food-wise, a lot of rice and soup and ramen noodles and yogurt, stuff like that. But the other huge difference is my congestion level. Tomorrow will be 2 weeks since I had surgery, and I dealt with severe congestion. I could not move air in or out of my nose for a little over a week and a half after the surgery. It was pretty frustrating. I knew to expect it, but I did not know it would be as severe as it was. My nose was completely blocked with blood and mucus, and of course I had the splints in still at that point. But I got the splints out on Tuesday. Like I said, today is Sunday. And finally on Friday, my airways opened up in my nose and I could finally move air in and out, and it was such a glorious feeling. I was getting very frustrated not being able to breathe. So today is day 3 of actually having open airways. I have kind of kept expecting them to close back up. There were a few times in the past week where my nasal passages would open for just a few minutes and I could get some air in, but then they would close back up. So I was kind of expecting that to happen on Friday when they opened up, but they stayed open all day and all night, and then all day yesterday and all night last night, and then all day today. So it's been really nice. The air is cool, but it's beginning to not feel so cold as I breathe it in. I think everything was just irritated, and my turbinates were pretty inflamed, so the air was a little weird feeling trying to breathe. I hadn't breathed in, about a week and a half through my nose, so it was a little odd, but I'm getting used to it, and it's such a nice feeling to be able to breathe. The doctor's saying that my inflammation could last 2 to 3 months, and it won't be until then that I can tell the true benefits of the surgery. So I can't really speak yet on whether I feel, a huge difference between how I breathed before the surgery and how I breathe now. But I am curious to see how that plays out. I'm still dealing with a lot of pressure in my sinuses, especially in this area right here, and dental pain here and here. But I had maxillary sinus surgery, which are the sinuses down in this area, so it's to be expected that I'm still dealing with pain and pressure in that area. I'm doing nasal sinus rinses. Some people use air, some people use ocean. I just use the off-brand from CVS, or CVS brand, and it works fine, and I'm doing that 5 to 6 times a day. Each time I do it, I just spray 3 to 4 sprays up each nostril, and that's just meant to not only irrigate but keep things very moist up in the nostrils, and that helps with scabbing and just overall healing. I'm not doing neti pots yet. The surgeon wants me to wait until a month out from now, and I may not even need them then. So right now the only spray I'm using is the saline spray. I'm still sleeping elevated. I would love to be able to sleep laying down, but there's still enough congestion and pressure in my face that the doctor's office wants me to continue to sleep elevated. So I am still doing that. I haven't really gone out and done much. I've really taken it easy. This surgery was pretty hard on my neck primarily. And I really just wanted to take things easy before I get back to normal life this coming week. Sitting outside, enjoying the weather, and just trying to heal everything. I will say I am a little bit shocked by the amount of blood clots that have come out of me and the size of some of them. I had a blood clot come out of my right nostril on Friday that was almost the size of a quarter. I was so impressed by it and so proud of my body's ability to get something like that out of my nose that I laid a quarter next to it and then took pictures and sent them to friends and family. It was a huge blood clot, and it was followed up by some bloody mucus. I'm still hacking up or coughing up blood clots that are sitting in the back of my throat, and that's happening several times a day. But when I blow my nose primarily now, I'm just getting a little bit of, yellow to clear mucus, so that has cleared up a lot. And I've been told to expect to, have blood coming out of either my nose or my throat for a few more weeks. So things are going good. I'm happy to be out of the bed and up and trying to get moving again. I do look forward to seeing what this does to relieve the headaches that I've been having, and the sinus infections and the sinus pressure and dental pressure. I am still dealing with slight headaches. It is springtime, and we have a lot of pollen in the air, so I'm not sure if it's allergy related or if it is related to the surgery, but there are headaches kind of right above my eyebrows and then down into the bridge of my nose. But they're nothing like they were before the surgery, so I do expect that they're going to get better. And I just look forward to seeing how this surgery helps me, what the benefits are. I know the true test for me will be when I get another sinus infection, seeing the recovery time and how severe the sinus infection gets, because that was a huge issue for me when I would get sinus infections, which was regularly just the length of time they lasted and how severe they were. So I'll try to update again sometime in the future. I'm not really sure when. If anyone has questions, feel free to ask. I would love to try to answer them and ease any fears for anyone that may be having this surgery or considering having this surgery. And I just am so happy to be on the mend. So thank you for watching my video, and have a good day. Bye.